Hello. Thank you for having me here this evening. My name is Barb Chaney, and I'm a registered nurse. The CHPN behind my name stands for Certified Hospice and Palliative Care Nurse. I have been a hospice nurse for 16 years and currently work for Iowa City Hospice. What I'm going to be talking and speaking with you guys tonight about is hospice criteria, admission criteria, and the Medicare hospice benefit. That includes discussing in a little bit more detail the multidisciplinary team approach, equipment, medications, and supplies. But what I want to first share with you is my personal story and why I even work hospice and why I continue to work hospice. In 1986, my father-in-law was diagnosed that summer with cancer. He was 42 years of age. My husband John and I lived out of state 7 to 8 hours away, and we made the decision we were going to move back. We wanted to be with Jerry and the rest of our family as we went through this. Jerry underwent the typical treatment of chemo and radiation, and in February of 1987 was declared cancer-free. He was present at our son's birth at Mercy Hospital in Iowa City that following April, but then in May started to have symptoms again. A second surgery was done, and the surgeon basically closed him back up and said, there's nothing more we can do. Jerry at that time decided no more treatment. He wanted to be at home. He wanted to be with us. He wanted to live in that log cabin that was made out of the timber of the trees that they owned. He didn't want us driving the 45 miles back and forth to Iowa City, especially with a little baby. Hospice was a word none of us had heard of. I really don't think even the medical profession had a very good understanding at that time of what hospice even meant. Iowa City Hospice was not Medicare certified until 1988. As you can tell from this graph, which is provided from the National Hospice and Palliative Care Association's website, back in 1986, there was only about 1,550 hospices nationwide. That has grown to the figure there showed for 2013 to over 5,800 now. So an immense growth in hospice service providers and such a better understanding of what hospice means. So how do you get to be admitted to hospice? It starts with a referral, and that referral can come from your physician, it can come from an ER visit, yourself, or even a family member. At the time of referral, the physician must be able to certify that your prognosis or life expectancy is 6 months or less and defines for hospice what that terminal diagnosis is. Many of us think of cancer as the only reason why hospice can be used. That's not right. The biggest percentage is a cancer diagnosis, but as you can see from this graph, which is provided through the Medicare Hospice Benefit Manual, more than half of the diseases that are treated under hospice care are non-cancer diagnoses. So you've got dementia, heart and lung disease, ALS, strokes, comas, much more than just cancer. So what do I mean by a multidisciplinary approach? It's treating the person holistically. It's providing support and education to this family and caregivers. We treat the mind, body, and soul of a patient. Hospice staff are specialized in end-of-life care, and we are aggressive with our symptom management. We want our patients to be comfortable. We want them to have a high quality of life. Hospice treats the whole person. Again, a holistic approach. We're focusing on the physical, emotional, psychosocial, and spiritual needs of that patient. Your physician can continue to be involved, or you can use the hospice medical director. Nurses, which is what I am, must be available per hospice or per Medicare requirements 24 hours a day, 7 days a week, 365 days a year. We must be on the other end of that phone to help a patient and family get through symptom management, to provide reassurance to that family that they're doing the right things. We had no support any kind of expertise on end-of-life care when Jerry was going through his disease process. Home health aides are the most intimate care providers that a hospice can have. They help with showers, with bathing, with massage. Social workers also provide that psychosocial support for that patient and family. They can assist with the funeral planning. They can help contact a family member that you haven't spoke with for years. They do a lot of grief and loss counseling. Spiritual is another aspect of hospice service. When Jerry was very ill and we knew he was reaching the end of his life, we called Father Ebel to come out and say a prayer with us. It was in the middle of the night, and Father Ebel was driving down that long lane. We could see his headlights, and we're like, oh, this must be Father Ebel. Jerry hadn't spoke to us for days, and he actually verbalized, oh, good. He was able to mouth the Lord's Prayer when we said that at his bedside. To me, that proved that that spiritual aspect is just as important as the physical, as the emotional aspect of a person. Volunteers are another thing that Medicare says you must provide to your patients. They can help with companionship. They can read a book. They can run errands, do some light housekeeping, maybe rake the leaves, take that dog for a walk around the block. Music therapy, physical, occupational, and speech therapies are also provided. Medications. Medications must be provided to a patient, those that are related to the terminal diagnosis. Again, aggressive symptom management, making that patient comfortable. So pain medications, morphine, oxycodone, fentanyl patches, IV infusions, sub-Q infusions, all of those things are used. All of those things are individualized to what that patient needs. When Jerry was very sick, he was in a lot of pain. We used Demerol injections, something I've never used in my 16 years of hospice. And there's a reason for that. They have a terrible side effect with long-term use, and that is they cause seizures. Jerry had seizures, and we didn't know why. Anticonvulsant medications, bowel protocols. So when that hospice nurse shows up at your house for that weekly assessment and asks that dreaded question, have you had a bowel movement this week? Anxiety, restlessness, delirium, hallucinations are also things that are seen at the end of life. Jerry was very adamant that he had to go to the bathroom. Kept telling us, I need to go to the bathroom. I need to go to the bathroom. We took the door off the hinges. We firemen carried him to the toilet because he was too weak to walk. He wasn't able to go. Looking back now, I know that was terminal restlessness. We would have treated that with medications. We would have taken the edge off for him, made him less agitated, made him more comfortable. Equipment is also another aspect that needs to be provided for hospice patients. A commode. There's a thought. We could have used one, and we had no idea. We had no idea we needed one. An electric bed. Jerry slept on our couch, on his couch. It was too short for him, and he never complained. But oh, how a hospital bed would have been a great benefit to him. A bedside table, wheelchair, walkers, shower chairs, Hoyer lifts, a lift chair. All of those pieces of equipment that help with the quality of life for that patient. Supplies are also required to be provided to patients. Depends, pull-ups, mouth swabs, oral sprays, wound and dressing supplies, catheter supplies, feeding supplies. The basement at Iowa City Hospice is full of supplies that are available for patients. In closing, I just want to reiterate how very important the interdisciplinary team and those visits are to the patient and family. They are what makes hospice unique, in my opinion. The medications, equipment, and supplies are also something that the hospice Medicare benefit requires a hospice service to provide to those patients. When Jerry passed away, it was that next morning after Father Ebel made our visit. He died while Father Ebel was saying Mass, and at the same time that Father Ebel was asking for the congregation to pray for our family. I don't find that a coincidence. Jerry was a person before his time. He embraced the hospice ideology long before hospice was a word that is heard very often in our society. He lives on through our stories of him to his grandkids. He was 2 days short of his 45th birthday, just 18 months after his initial diagnosis. Jonathan was present at the time of his death. It's something he will never remember, but it is something that is truly cherished by our family. Jerry continues to have an influence on me, personally, of course, because he was my father-in-law, but also I share his story and our family's story of how we got through that. Not with everyone, with an occasional family, but it just shows to me what an influence his life and his death continue to have for me, and for that I am forever grateful. So at this time, if you guys have any questions, I would be happy to answer them. Thank you.